Hi, and welcome to Custer Health. I'm Keith Johnson. I'm the administrator here. Custer Health is a 5-county health district composed of Morton, Oliver, Mercer, Grant, and Sioux counties. And we provide public health and preventive health services for this entire area. So, welcome to the world of traveling. You will not be confined to one program here. You will not be confined to one area. We are in the business of preventive health, and we think it's important that you as a nurse be able to see what preventive health services are all about as compared to the remedial health services that you're probably more used to. We provide services to a population, not just to individuals. We try to keep that population well. So welcome to Custer Health, and we hope that you will enjoy your time with us.
Hi, my name is Paige McDaniel, Environmental Health Practitioner at Custer Health. As a student nurse, you may be assigned to me to go through food and beverage and also daycare inspections. On a food and beverage inspection, we will be checking food, cleanliness, and also personal hygiene of the employees. During daycare inspections, it is a basic safety inspection and also a food and beverage inspection to make sure the children are safe.
Hi, I'm Shannon Spots with the Bismarck Mandan Custer Health WIC program. WIC is the Women's, Infants, and Children program. We provide breastfeeding education and promotion, screenings and referrals, and supplemental foods such as infant formula, baby fruits and veggies and cereal, milk, cheese, juice, eggs, peanut butter, cereal, and whole grain. Who we serve are pregnant women, delivered women, breastfeeding women, infants, and children up to the age of 5.
Hi, I'm Chelsea. I'm one of the nurses at the Golden Age Club. Mandan Golden Age is a senior center that provides meals, activities, transportation, and health maintenance services to individuals over the age of 60. The Health Maintenance Clinic is a contracted service, and Golden Age pays for the nursing time. Clients are asked to provide a suggested donation, but they are not turned away for inability to pay. The Health Maintenance Clinic is Wednesday mornings from 8 a.m. to 12 p.m. Services provided during the Health Maintenance Clinic include blood pressure, fasting blood sugar, foot care, hand nail care, rapid inspections, and health education. Golden Age is located at Liberty Heights. The driving directions are in your packets. Please meet there on your scheduled day.
Hi, I'm Melanie Konechka, one of the nurses here at Custer Health, and I'm here to talk to you about Health Tracks. Health Tracks is early and periodic screening, diagnosis, and treatment. It is a federally mandated healthcare benefit package administered in partnership with each state for essentially all Medicaid-enrolled children, ages birth through the age of 20 years old. The mission is to provide initial, periodic, which are established intervals, and interperiodic, or whenever a problem is expected, examinations. No referral is needed for interperiodic screenings. The standard is through Bright Futures guidelines, which are consistent with the American Academy of Pediatrics and the American Academy of Pediatric Dentists guidelines. Typically, we see clients on an annual basis for screening. Diagnosis and treatment are triggered by the screenings. Conditions do not have to be new to be treated. Treatment does need to be provided by a Medicaid provider. While they are with us, we will do a health history, a head-to-toe physical exam, identification of all medical conditions and needs, immunizations according to ACIP schedule, age-appropriate lab tests, health education, including anticipatory guidance, a developmental assessment, nutritional assessment, mental and behavioral health screening, vision screening, hearing screening, oral inspection, and referrals for treatment for any necessary services. There's an emphasis on immunization provision, lab tests for lead toxicity, mental and behavioral health screenings, vision, hearing, dental services, and health education on healthy lifestyles and practices and injury disease prevention. Common referrals are dental and orthodontics, follow-up physician care, mental health, early intervention, Right Track, Head Start, Morton Sioux Special Education, NDSU Parent Resource Center, Big Brothers Big Sisters program, and community aid services. We can also link at-risk adolescents to pre-pregnancy risk education, family planning, and prenatal care. When you are assigned to health tracks, you will be following an RN through part of the day or all of the day. In Mandan, we team with social services, and a social worker conducts the initial hearing vision screening and the mental health assessments. We typically schedule 7 clients in a day with a variety of ages. If you're assigned to Fort Yates, you must be ready to leave at 8 a.m. Bring a lunch and expect to return no earlier than 4:30 in the afternoon. After observing 1 or 2 clients with the RN, you will probably be allowed to conduct the head-to-toe assessment. You will want to have your immunization checkoff forms with you to document any observed immunizations, and if the opportunity arises for vaccination, you should be able to have that documented as well. Be sure to ask any questions during the screening day to optimize your learning opportunity.
Hi, I'm Jody Fetch. I'm the Home Health Coordinator at Custer Health. A little bit about our home health program. We are a maintenance home health, which means that we can see patients up to 1 time a week at the most. A lot of times we fill the need that the other home health agencies can't fill, and vice versa. We do a lot of referrals back and forth. We serve 5 counties, and those counties are Morton, Mercer, Oliver, Grant, and Sioux. We do have nurses in the Stanton office in Mercer County and nurses in the Grant County office in Carson and also in Oliver County. How we get referrals is we get referrals from clients themselves, from clients' families, doctors, hospitals, other home health agencies, and lately we've been getting a lot from nursing homes where patients come back into the home after being in a nursing home. Our payment program is a sliding fee scale. We also accept Medicaid. We are just switching to electronic health records, so that has been a new experience for us and a challenging one. So we are documenting everything on NetBooks in a internet-based medical record system. And our normal home health client visit would include a medication setup, cardiopulmonary assessment, a pulse oximetry, we do foot care, we also do INRs, we have a portable INR machine. And as students, junior students, you would follow a nurse for the day doing home health clients right along with her. And if you are a senior student, you would hopefully have your own client. We usually do that for a 6-week stint that you'd see your client on your own. Also, please remember to bring your stethoscope, your watch, and a pen along on visits.
Hi, my name is Heather Weaver and I'm the Immunization Coordinator at Custer Health. Custer Health provides immunization services for adults, adolescents, and children. There are many different opportunities that you will have to participate in immunizations at Custer Health. Some of those will be during our immunization clinics here in Mandan and also in our county clinics such as in Glen Ellyn and Hebron. Other opportunities will be during health tracks, nurse of the day, even during our flu clinics that are coming up this winter. Some of our nurses do immunizations during home visits as well. Part of the immunization process here at Custer Health is to have nursing students do an orientation to become familiar with how immunizations are given at Custer Health. You will participate in the orientation, which will include a video discussion and a skills checkoff. This orientation is required by all nursing students and is scheduled as part of your clinical experience here at Custer Health.
Hi, I'm Chelsea. I'm the coordinator for the Bambi program at Custer Health. Bambi stands for Babies and Mothers Beyond Birth Education. This is a newborn home visit program that is offered to new parents after they have left the hospital, and it's to provide support and education to those families. This program was started in 1996 by Custer Health, and it serves 5 counties: Morton, Mercer, Oliver, Sioux, and Grant. The new parents complete a referral form before leaving the hospital, and it's faxed to Custer Health. A phone call is made within the first 2 weeks to schedule an appointment for a visit if they would like. The visits last approximately 1 hour, and there is no charge for the service. Additional home visits may be made if necessary. An example of that would be for a weight check. The services provided while in the home include assessments for mom and baby, answering questions related to the baby and other concerns that they may have. A folder is provided with different educational materials and making referrals as needed. Examples of that would be for the physician if there are concerns, the WIC program, or Right Track.
Hello, my name's Peggy Peel. I am the Women's Way Coordinator here at Custer Health. I'm a registered nurse and working with the program, it's a breast and cervical cancer early detection program. And what that means is that we help women get the services, their women's health services, a breast exam and a mammogram, ages 40 through 64. And as a student working with this program here at Custer Health, we will be having you go to Fort Yates, where we do breast health outreach, and also McLaughlin, South Dakota on the Standing Rock Reservation. We start our day down there at 8 o'clock. We leave here at 6:30, quarter to 7, and it's a long day. We take our lunch and water. And what your role as a student nurse there will be is education primarily, teaching the self-breast exam to the clients one-on-one, or colorectal cancer screening education, and assisting the women working their way through the screening event. We usually see up to 30 women, so it is a busy day, and so we expect you to come ready and with a smile, and we'll have a good time. It is really a good experience for you, one that you'll remember in your nursing career.
Hi, I'm Jody Fetch, the Men's Health Coordinator here at Custer Health. We have a men's health program in Fort Yates, North Dakota on the Standing Rock Reservation, and also in McLaughlin, South Dakota. We started this program in 2003 with a grant from the Spirit of Eagles, which is a foundation out of Mayo Clinic. We offer 5 events per year, and during those events we screen men for prostate and colorectal cancer. We have had 813 screenings completed to date, and with that we have diagnosed 8 prostate cancers and 5 colorectal cancers. We do have student opportunities. You can come to one of the events with us, and usually students do either colorectal cancer education or prostate cancer education. And it will be a 10 to 12 hour day. We ask that you bring your lunch along. It's a very great opportunity to visit with the men of Standing Rock Reservation.
Hello, I am Brady Weaver, Tobacco Prevention Control Coordinator for Custer Health. We are a program that works mainly with 3 goals, the first of which being work with advocate for smoke-free school policies or tobacco-free school policies. The second component that we work with is local smoke-free policy. We work with communities in our area and advocate with policymakers on smoke-free laws or smoke-free ordinances. So in having smoke-free public places and smoke-free workplaces. We work with all policymakers from city level, county level, to the state level to advocate for laws regarding smoke-free areas. The final area that we work with deals with cessation or helping people quit using tobacco. We follow public health service guidelines here at Custer Health, and what that means is all of our clients that walk through the door are assured that they are asked tobacco use questions. Whether they're a tobacco user or not, they will be asked. If they're a user, they will be referred to quit services, either through the North Dakota Tobacco Quit Line or the North Dakota Tobacco Quit Net. Nursing students in the past have contacted our program for research projects, for information to help them complete those. Stop by our office if you have any questions while you're here, or feel free to contact us afterward throughout your schooling, and we're always available to help with any resources.
Hi, I'm Melanie Konechka, and I'm one of the nurses here at Custer Health. I am here to tell you today about Nurse of the Day. At Custer Health, the Nurse of the Day hours are from 8 to 9 in the morning, 12:30 to 1 in the afternoon, and 3:30 to 4 in later afternoon daily. Nurses are available to attend to walk-ins, telephone questions, and limited appointments as scheduled. Typical walk-ins are for adult immunizations like tetanus, flu, or pneumonia, blood pressures, or ear checks, head lice checks, and TB skin tests. Occasionally, we will see blood sugar testing, bike helmet fitting and distribution, hemoglobin checks, suture or staple removal, pulse oximetry, urinalysis, and hearing or vision screening. We have a few regular walk-ins for B12 injections and MediPlanner exchanges. These are home health office visits for limited service. The nurse managing those clients with MediPlanners usually have them prepared for the nurse of the day. Appointments are frequently set for foot care, immunizations, and car seat distribution. We have 3 car seat technicians and a regular car seat appointment schedule. But if only a booster is needed or schedule is full, some exceptions are made. Foot cares are usually done with the client's nurse, and the immunizations vary when they are scheduled. There are some lab services we are able to provide with standing orders, like blood draws for HIV and hepatitis C, which are done by our HIV coordinator, and varicella titers if it's needed. As a student, you will have the opportunity to follow the nurse on duty. Fridge temps are monitored at the beginning and end of each day. A beeper is warned to call the nurse to the front desk when they're needed. Telephone calls will come randomly to the nurse at her desk, and topics vary greatly. If a walk-in comes in to have a vaccination, you will want to have your immunization checkoff form with you to have your observation noted, or the opportunity to vaccinate may present if you have already observed. All client encounters conducted during Nurse of the Day are recorded in the electronic nurse log. If you have any questions regarding the opportunity, please ask the nurse assigned to the duty that day for more information.